Prostate cancer is just one of the many male taboos, and it doesn't get as many column inches as breast cancer, but it's just as common and it's just as serious. Here's the wake-up call. The disease kills 10,000 men every year in the UK, and although the chances of survival are much better than they were, say, 30 years ago, if it's not caught early enough, these chances can be severely reduced. Now, to offer advice on what signs to look out for and who's most at risk, I'm joined by Mr. Prokar Dasgupta, who's a consultant urological surgeon, and Liz Adlam, whose husband passed away last year as a result of prostate cancer, so sadly knows only too well what a devastating disease this can be. Well, thanks to both of you for joining us. Thank you for coming in. Can we just start off, Prokar, by talking about the prostate itself? What is a prostate? Where is it? And why do we have one?
Well, the prostate, Murray, is a very male thing. Women don't have it. Thank goodness they have other things like breasts, but not a prostate.
Okay.
So the prostate is a little chestnut-like gland. It sits just under the bladder. The bladder is the bag into which we fill urine. Otherwise, we all would be peeing all day.
Yeah.
So the prostate in men is sitting just under the bladder, from where the tube comes out through which we pee.
Mm-hmm.
And this gland, you could say, why only in men? Well, there are various theories behind it. People think that it adds things to the semen, so it keeps the little sperms happy and healthy. But in the end, it's not just there for no reason. It can get diseased. About 1 in 3 men after the age of 50 will have something wrong with it. And if you look at prostate diseases altogether, almost half of men at some point or the other will have something related to the prostate.
You think we would know a lot more about it with those figures? If half of all men are going to have something wrong with their prostate, you'd think we'd all know instantly about this. Why don't we?
Well, thankfully, some of us don't, and those of us who don't merrily live along forgetting that they have it and don't discuss it with anyone else. For those who do, it can be an embarrassing problem. It's not very nice to have to stop going somewhere because you are going frequently to pee. It's not very nice to wake up 20 times in the night because you have to pee, because it's not just you who's not sleeping, it's also your wife or your partner who's awake with you. So there is a taboo around the prostate, more so because we are men and we are macho and we don't want to talk about it.
Yeah, we're big and brave and we don't talk about things like that. That's what it is, apparently. Liz, thank you very much indeed for joining us. Thanks for coming in and thanks for being so prepared to tell your story. I know it's very close to almost the anniversary of your late husband's death now. From your perspective, hearing all of this, you know only too well how devastating it can be. But where did it all start for you? What were the early signs for you?
Well, my husband was very brave and never really told to anybody an awful lot, but went to our GP, and sadly the PSA reading was not as high as what perhaps it should have been for any other tests to go any further. So therefore, he didn't have any other tests done. The months that followed, things got a little worse, and it was, as you say, a nighttime problem, or as Prokar says, nighttime problems, going to the loo, etc. And eventually, when it was eventually discovered, it had then gone into the bone, so it had escaped from the prostate, and there was no chance of, it was inoperable, no chance of surgery, and he had to go on through the various therapies, chemotherapy, etc. And from the day that we actually found out what it really was, up to his death was only 18 months.
Wow. That's pretty short, isn't it?
Yes, it is. Yeah. We had a good 18 months.
So what are the symptoms of prostate cancer? Now, I know we've already talked about a couple of them there. Let's just list them nice and clearly. What are they?
Well, they can be divided into 2 bits. Firstly, dealing just with the waterworks, in inverted commas. So, for example, slowing of the stream, or going more frequently to pee, particularly at night, or even having urgency. Some men, because they have obstruction at the level of the prostate, remember it's just sitting under the bladder, will leave a lot of urine in their bladders, and some of them will feel it. They feel they're not emptying their bladders. Occasionally, because you have stagnant urine in the bladder, you would develop a urinary infection. So those are the main things which are related to the waterworks. Occasionally, you may even have blood in the urine, and we would find that you have prostate cancer. The other bit is not related to the waterworks, which men oftentimes ignore. An elderly man, if he comes with pain in the bones, this is something you have to suspect. In fact, when I went to medical school, I was told by my ex-chief, look, if a man has pain in the bones and he turns up, you must examine his prostate. Very sound advice, because, as Liz knows only too well, the cancer may have gone into the bones, and in some men that will be the first time that they know something is wrong with them. By that time it's possibly too late, but there you are.
So, telltale sign, waterworks, as you've already said,
Correct.
but it could be waterworks are fine, but it's in the bone already, aching bones, that could be another sign.
Indeed.
Is it genetic? And there's further questions to this, or is it something that smoking or other such sort of social habits and age can bring it to be?
Well, it is a combination of two things, and that is true for most diseases. It's not just the genes, it's not just the environment, it's a combination of the two. So if you have a first-degree relative, say your father or an uncle who has prostate cancer, and the younger that relative, it increases your chance by twofold. If you have two such relatives, it goes up by fourfold. And now, of course, people, with the discovery of the human genome, people are more and more looking at it as a systems disease rather than just a one single hit gene which you look for. So it is more of a systems disease. But at the same time, there are environmental factors. We know that prostate cancer is not that common in the East. In India, for example, it's much less common than it is here.
Sure.
But if you bring an Indian man and keep him here for a number of years, his chances go up to almost the same as it does for a man living in the West. So there is an influence of environment along with the genes.
What about age? Can I just touch on the age subject here, because for most men when they get near to 50 they get a little bit touchy about age anyway, so this is even more bad news then.
Yes, absolutely. I mean, it is more common. Over 60% are still above the age of 70, and between 70 and 79 is when majority of patients are being diagnosed. But you know, when I was a senior resident many years ago, 3 in 4 men were coming in that age group with cancer already being in the bones. Now there is a paradigm shift towards the other end, which is where we are picking up prostate cancer in younger men, in their 50s, in their 60s, or even in their 40s.
Right.
And therefore it is no longer true to say it is only a disease of older men. There are younger men getting the disease, there are younger men in whom we are detecting it, and perhaps we are getting better at detecting it. And therefore the treatments that we are able to offer to these men is changing at the same time as the diagnosis.
How did you get your husband to go for the test to find out? Because one of the things that's always comes up whenever you talk about prostate cancer is that men are reluctant to go to the doctors. They're reluctant to have a test. But in terms of going and discovering whether you've got something wrong with your prostate or not, it's a difficult thing to get men to do, isn't it?
It is, but he did actually go, without me badgering him, he did actually go. But at the Christmas time, when we were trying to make appointments, I then pushed and pushed for the appointments to come forward a lot sooner than perhaps what they would have done. But he did go in originally, you know, on his own accord. I didn't have to badger him there.
I think the thing I was going to get across is that we can talk about Men's Health Awareness Weeks, which we have plenty, Father's Day. Families should be talking about this. Fathers and sons possibly should be talking and communicating with each other and almost encouraging each other to have this test done. Absolutely.
I think awareness is all about talking to each other within the family. I think there's no point in hiding it out of embarrassment, because that is of no use to anybody.
I just may add, there's a lot of people of our age, or my age group, in their 50s and 60s, who don't know what our fathers had, our grandfathers had. And they may have been suffering with prostate problems. So I have 2 sons, so I have to look back at what my father-in-law's lifestyle was like, and now my husband. And then obviously I'm very concerned that both my sons will be tested. I understand when they're about 40.
And again, you'll sit down and talk with them about that, obviously. As something that's touched your family so closely.
Oh yes, to everybody out there. Everybody out there, yes. No, please, you know, all you chaps, go and get tested. I'm sure listening today, there must be somebody amongst however many people are watching us that's going to stop and think, oh, I go to the toilet a bit too many times during the night, or oh, I've got a bit of a pee problem. Go to the doctors, please.
It is no longer the case that if you have prostate cancer, it's a death wish. It isn't. There are good treatments which can cure it.
Prukha and Liz, thank you very much indeed for joining us today.
Thank you, Mary.
If you want more advice, then you can go to a website. It's www.prostate-cancer-research.org.uk.